Hi everybody, welcome to week 6 of your Practicum course. We are almost a third of the way through this course already. It is just like zipping along. I hope you're feeling good about the progress that you're making. So let's look at this week. Our discussion question this week is essentially an extension of our discussion question last week. So last week we were looking broadly at assessment and evaluation and the MLN competency that dealt with those topics, right? So now this week we're going to get real specific into the nitty-gritties. So identify one method that you believe to be effective for assessment in each domain: cognitive, psychomotor, affective. Okay, why you think those would be effective and how you can use them. All right. So I think we'll have some good discussion. You guys, I know last week had started bringing up some really good assessment and evaluation strategies, so we're going to dig into that a little deeper this week. And I thought I would share with you some different assessment and evaluation strategies that I've used that I think have been fairly effective. So just a few. Every once in a while, I'll put together a debate on a topic. Particularly if I'm teaching something like research or maybe management, something like that. Or maybe if I'm dealing with inequities in healthcare, that's always a good one. So sometimes forming a debate can be kind of cool. Case studies, and we talked about regular case studies, unfolding case studies. Have you ever thought about having your students write a case study? One way that sometimes instructors have kind of assessed how much knowledge students have about a topic is to have them write example test questions. Well, maybe you could divide your students into groups and have them write case studies and what they hope the case study itself, questions about the case study. You can really find out how much somebody knows about that. This can be used with nursing students in academia. This can be used for unit-based theories class. I could see it, I used to be a NICU nurse, and I had quite a bit of theoretical classes to go through before I hit the unit with my mentor or my preceptor. And I could see that that particular strategy being effective. Care plans, dear old care plans. Do you ever remember in nursing school writing care plans that were like that thick? So care plans can definitely be used to show the knowledge base of the student. Something that I sometimes has used an alternative to care plans are concept maps. And if you don't have any experience with concept maps, let me know and I can post some information about them. But concept maps, working off of a central hub of patient characteristics, then identifying nursing diagnoses, goals and interventions. So you have a lot of the components in a nursing care plan, but it's in a very visual form and the students can start to see how connections are made. There's not as much verbiage. It's not, reams of paper. And concept maps can be used with all sorts of things. So they can be used with pathophysiology, just all sorts of things. I really like concept maps for those of you that have students that are visual learners. Peer review. Peer review is tricky, okay? But if you have students do presentations, papers, a PowerPoint, skits, posters, anything, you could have peer review as part of that process. So when the student who created the poster, the PowerPoint, whatever, receives that feedback, they learn if they had any deficit areas, things they forgot to include. The students writing the peer review you can really see what their thought process was like. Did they understand the concepts based on what feedback they gave? So that's a possibility. I think we've talked just a little bit about flipped classroom. For some of my classes, I have used flipped classroom when I've taught on ground. Not to a full extent where I don't provide any lecture at all, But I've done flipped classroom where I've given the students a list of questions, maybe 5 to 10 questions, and they have to answer those questions. So print it out, answer those questions based on the reading or video or whatever I provided for them, and that was their ticket to class. They couldn't come into class unless they presented a completed answers to those questions. And so that helped my students be really prepared for the active learning strategies like group work and all sorts of things that we were going to do in the class to get the students engaged and to really do a deeper level of learning than maybe what a simple lecture would provide. So flipped classroom is an interesting concept. Games are fun. I don't know about you, but my students, whether they've been nurses or nursing students, can get a little competitive whether or not there's any prize on the line. I've done the common like Jeopardy type categories. I've done that as a review before a major unit exam or something like that. So gaming can be kind of interesting. One strategy that I've used, and you probably won't be surprised, is I've used movie clips. So one time I was teaching a fundamentals class, well, a couple times, and we were working on formulating nursing diagnoses, and I showed some short clips from The Wizard of Oz. And we talked about Dorothy, we talked about the witch, the bad witch, the good witch, we talked about the wizard, and as a class, we came up with nursing diagnoses that could potentially apply to the various characters in the movie clips. And people really enjoyed that. Now, if you were teaching undergraduates, maybe you would have a more up-to-date movie clip. But anyway, that is a thought. So those are just some ideas about the things that I've used in classes that were just a little bit different, enhance student engagement, and cause deeper learning, but I could see in the end what the students had learned, where their deficit areas were. So assessment and evaluation was there were definitely components of those strategies. All right, few things. NEPD is going to come up again this week, and a couple of you had asked about practicum hours. So your practicum hours have to be done by the end of the course. I think your final evaluation from your preceptor is actually due, I'm thinking week 15. It's 15 or 16, but I think it's 15. So you need to get your hours done by then. I've talked a little bit about the midterm evaluation, and that needs to be completed by your preceptor when you're about halfway through your hours. If you are not halfway through your hours, if you're really a lot below that mark, then I would really sit down with your preceptor and plot out the rest of the course and make sure that you're going to have the opportunity to get in all of your hours. Definitely a requirement of the course, have to get in and pass. Okay, let's see. One real forward-looking that I think I briefly mentioned before is that portfolio due in week 13. Information in week 13's portfolio that you have to provide is very similar to the initial posts you do when we discuss the various NLN competencies in class. There's a twist, though. It's more focused on what have you done. It's like accomplishments because it's a portfolio. So anyway, if you write really good initial responses to the DQ questions about the NLN competencies, those can be reworked with not a ton of effort to be able to use in your portfolio. Also in your portfolio, you need to provide a list of references, but then you have to have 2 letters of reference. Just wanted to remind you about that. It's always nice if you could possibly get a letter of reference from your preceptor. So just throwing it out there. Yeah. All right. I will probably also post this. In other words, write it out on my post. But I do have a class question. So I want you to put yourself in the place of an educator, and you are teaching a pharmacology class. Now, this could be for undergraduate nursing students, regular old pharmacology. This could be for a specialty nursing orientation for actual nurses. Maybe it's on drips used in the ICU. Maybe it's on induction, methods of induction in OB. Some type of pharmacology topic that your nurses really need to get a grasp on. Maybe it's insulin drips, whatever. You are the educator, you are teaching about this. Sometimes this can be a little bit of a dry topic. Sometimes nurses and students have a little bit of a trouble grasping some of the concepts. What types of formative assessment strategies would you use while teaching a pharmacology course class? What a course or class. What type of formative assessment strategies would you use to be able to identify that your students were keeping with you and that they were truly grasping the concepts? So that's the question of the week. All right, I think that's about it. This was a little longer of a video, but I hope you got something out of it, and I will see you in the main forum.